At the end of the year, I see this happening with leadership. They look at wellness survey data and say, our wellness program is working. Satisfaction scores are high. People love it. Then they look at healthcare costs, absenteeism, burnout, turnover, health outcomes generally, and nothing really seems to have changed progressively. The reaction is a bit of confusion because employees said they love the program. So here's the issue: morale and health metrics are connected, but they are not the same thing. And if we aren't honest about the difference, we end up misreading both. Morale measures how people feel about the experience. Health metrics measure whether behaviors, habits, stress levels, or health profiles actually changed. Both matter. A wellness initiative that improves morale can absolutely create value. People feel supported, connected, energized, and more positive about work. That's meaningful. At the same time, a program that improves measurable health outcomes creates a different kind of value: lower risk of illness, healthier habits, lower absenteeism, reduced burnout, and long-term sustainability. That matters too. The problem starts when organizations treat one as proof of the other. A company launches a wellness program built around engagement, fun challenges, social connection, events, incentives, and content people enjoy. Participation is high. People genuinely like it. The culture benefits are real. They're obvious. But 6 months later, health outcomes haven't meaningfully changed. On the other side, some organizations build highly structured health programs, rigorous tracking, accountability, coaching, a focus on measurable outcomes. Health outcomes improve in the short term, but participation soon drops. Employees feel overwhelmed, engagement weakens. The mistake isn't valuing one over the other. The mistake is measuring inaccurately. If the goal is morale, then measure morale honestly. Talk about engagement, culture, connection, and employee sentiment. If the goal is health improvement, then measure health honestly. Talk about behavior change, risk reduction, absenteeism, stress, or claims data. And if the goal is both, which for most organizations it should be, then acknowledge that those outcomes move differently and require different strategies, and for attention to be paid to what's in alignment with the associated outcomes. Because morale can support health, and health progress can improve morale. The best wellness approaches recognize that both have value, but they also stay disciplined enough to ask, what exactly are we trying to improve? And are we measuring that honestly? Because clarity is what turns wellness from something that simply feels good into something that creates real, lasting impact.